What's up, guys? Welcome to episode 48 of the safety section. Provide patient with appropriate method to signal staff members. All right, so this is basically talking about call lights. When we need to provide a patient with something to ask or request a patient or a staff member when they're not in the room. They need to be able to get a hold of somebody when you're out of the room. So basically that's a call light. You know, there might be other technology available at various facilities, but that's mainly what we're talking about. We want to make sure that the call light is within reach and that it works. I've seen multiple times, you know, maybe the patient, took them down to CT. We took them down to a procedure in the bed. So, and they have a handheld call light. So, okay, let me take the call light and I'll hang it on the wall, and then we'll take the bed. And then when the patient gets back, we forget to give them back their call light. So if you're a patient sitting in a bed, you know, you can't see all the interworkings of the wall behind you to find that call light, especially if you're, you know, sick. So it's important that we make sure that the call light is within reach at all times. You know, some beds have call lights within them, which is wonderful because if they lose track of the call light, they have something to grab onto and let somebody know. So it's important, number one, that they have one, that it works, and that it's within reach. Another thing too is they also have adaptive call lights that you can use in various settings. I've had patients that they're mentally with it, but they have arthritis so severe, or they have whatever going on that they cannot use a regular call, like can't hold something in their hand and push it with their thumb, or they can't push something with a finger. They don't have the dexterity to do that. Or maybe you have a quadriplegic patient who can't move their arms or legs, but you need to have like a pad or something that they can maybe move their head and hit it with their chin or their cheek, So at all of the places through nursing school, and I've been in quite a few facilities, they all had like an adaptive one. It's basically like a pad that you just push down on, and that activates the call light. So really important to make sure that they don't that a call light isn't just in the room, but it works and it's within reach, and it's something that works with the patient. So that concludes episode 48, Provide Patient with Appropriate Method to Signal Staff Members.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.